Hey everybody, this is JP from Cognitions, Speaking the Unspeakable with JP and Stacy D. The title of this video is Do's and Don'ts for Parenting Kids Struggling to Focus, Concentrate, or Pay Attention. I am making this video because lately I have had some sessions with parents and kids that were a little unsettling. Parents are struggling in this area with helping their kids to manage the symptoms of poor concentration, inattentiveness, etc., etc. And so one session was so concerning, upsetting, I'll say, some of the things that the parent was saying and doing to the kid due to their frustrations with this, put me in a position where this is the first thing I thought about when I woke up this morning is I've got to do something about educating parents on how to better help their kids with poor concentration. And so I did what I do whenever something is bothering me and it's upsetting. I immediately wrote down all my thoughts, all my thoughts on paper so that we can do a show on this on the radio show. Well, when I looked at the roster for the radio show, I quickly realized that it'll be months before we can get to this. And so I'm doing it here because this additional channel is for the overflow on things that we just do not have time to cover on the radio show. Okay, so I'm going to run down this list of thoughts, notes, do's, don'ts, ideas, things that I want for you as parents to think about. Now, let's take a look at this diagnostically. The reason why I did not call this video Parenting Kids with ADHD is because ADHD is not the only diagnosis that has the symptom of inattentiveness. Depression has the symptom of poor concentration. The anxiety disorders can have poor concentration and distractibility. So whether it's called inattentiveness, poor concentration, distractibility, essentially it's all the same thing. They're having trouble focusing and paying attention. Now, something that I want you to remember, please keep this in mind. These are psychiatric diagnoses. They are not behavioral diagnoses, which means kids have no control over having these diagnoses. They have no control over struggling with this symptom. So remind yourself that this is about brain chemistry. This is about biology. Although the term is inattentiveness, these kids are struggling to maintain attention and focus on one thing because they are paying attention to everything. They are distracted. So that's the irony of it, is that the symptom is inattentiveness, but they're paying attention to this and that, and the car that just drove down the street, and they heard a bird outside, and they heard a sound from the other room, mom's in there burning up dinner. They are distracted. They're paying attention to everything, and you are wanting them to focus on one thing, and they're struggling with that. All right, so one thing that you can do is limit the external stimuli and the distractions. If you're talking to them in the room and the TV is on, pause the TV. Have them look at you in the eye, because this is something that can narrow their focus when you have them look at you. So say, hey, I need you to look at me. Pay attention, please. This is something you can do if you guys are in a crowded restaurant, if you're in a grocery store, you get their attention like, hey, could you pay attention? Listen to me, please. And then you give them whatever information or instruction it is that you are trying to give to them. Okay. Do not use terms like you're not listening. Not listening is a term for describing actively choosing to not pay attention to you, ignoring you. Basically, kids with a psychiatric diagnosis like ADHD or depression or generalized anxiety disorder are not actively choosing to ignore you. They're struggling. They are struggling. It's more frustrating for them than it is for you. Keep that in mind. This came up with a kid the other day. I was gathering information on the symptomatology, trying to assess what we were dealing with. Was it ADHD? Was it depression? Was it generalized anxiety disorder? And the kid described that they get in trouble all the time for not paying attention, for not listening. That's what the kid said. I'm in trouble all the time for not listening. And I had to explain to the parent, your kid is not choosing to not listen. That would be something that a kid with oppositional defiant disorder would be doing. Your kid is struggling and wanting to pay attention. Okay, something that you should do that will help with this is get a baseline for their attention span by measuring how long they are able to focus. Test this out by presenting information to them and then tracking the first initial signs that you have lost them, that you have lost their attention. And you can kind of tell sometimes because they'll look off in another direction, or, their eyes will go up in their head, or you can just tell they'll glaze over. You can tell, like, okay, I lost my kid. And then pay attention to at what point you lost your kid. Did you lose your kid 30 seconds into the conversation, a minute in, a minute and a half, 2 minutes? So you want to kind of measure it. One way that you can do this is just record the conversation. You record the conversation and then ask them in advance, though, before recording, I need you to let me know when you have shifted your focus. Let me know when, you're paying attention to something else. Adolescents oftentimes will be able to do this and do a good job at it. Now, the younger kids, of course, developmentally, they're not going to be able to do that. But I have had many adolescents point out, okay, what'd you say? If you are recording to get a baseline for their attention span, the length of attentiveness, you will be able to listen to that recording at that point where they lost focus to get an idea for how long they were attentive to what it is that you were saying. All right. Now, something else that you can do, and you can do this while recording them, or whatever means that you are using to measure, is ask them, what is the last thing you heard me say? And then go back and see, okay, how much did they retain of what I was presenting to them? Do not give large amounts of information and instructions at one time. These are not kids that you want to go on and on and on and lecture and do all that mess from back in the day. Okay, where parents would stand and lecture kids for an hour and expect them to have retained the information. Do not do that with kids who are struggling with inattentiveness, poor concentration, distractibility. Okay, they're not going to be able to do it. Avoid being tangential. Tangentiality is a pattern of speaking where the person goes off on all these tangents. And so in their mind, all these things are connected. But when you're talking to a kid and you're going off on all these tangents, that's a problem. Now, what it is okay to do is be circumstantial. Circumstantiality is providing a lot of clear, specific details. Typically, it's an excessive amount of details, but if you're dealing with a kid and you're giving them instructions on something you want them to do, circumstantiality can be a little helpful with that. Meaning, instead of saying, look, go clean your room, and then you go check the room and you end up upset because, okay, there's still stuff under your bed and your laundry basket is still full and you didn't do this and you didn't do that. Go ahead and give the specific instructions up front. Now, I'm not saying that this is something that you're going to always have to do forever. Okay, so from until my kid is 18, I'm going to have to give specific instructions every day when I tell them to go clean their room? No. But initially, until they are getting it right, you might want to do that. So please go clean your room. Do not forget to make your bed. Get all that crap from under your bed, because I saw that crap under your bed. And your laundry basket is overflowing. Please take it downstairs. Okay, that's 3 things. Stop at that point. Okay, now, what all did you hear me say that I want you to do? Well, you said make my bed, get the stuff out from under my bed, take my laundry basket downstairs. Yes. And then at that point, if there's a few more things that you want your kid to do, you can go ahead and present those things and see how well they do at tracking those things. All right. This became an issue the other day in a session. A parent went on and on and on, giving a long lecture. The parent wasn't even taking a breath. I mean, it was a lot. And the kid later said, I lost half of what he just said to me. I'm telling the truth. I was thinking, I lost part of what he said too. What in the world was he talking about? And so for the parent, he's tangential. He was off on all these tangents, and he went on and on and on forever. Even a kid who does not have ADHD or depression or anxiety disorders is going to struggle to hold on to all of that. It was too much. Like, it was ridiculous. Break that mess up. Break it up. Small pieces. All right. After you have given a small set of instructions, ask your kid, what did you hear me say? Now, if the kid gives you a little bit of it and other parts are missing, although this is frustrating, please try to be patient and just fill in the gaps. Remember, you're trying to help your child to improve their ability to focus and pay attention. If you become agitated and you start fussing at your kid, that in and of itself is going to be a distraction. And so they're going to be more focused on the fact that they have upset you than the information that you're trying to present. It's self-defeating for you to fuss at your kid for something that, as I previously stated, is psychiatric. They don't have any control over this. It takes effort to learn to manage the symptom. All right. Please be respectful of what they have to do just to accomplish as much as the kid sitting next to them in the classroom who does not have ADHD or poor concentration from depression or one of the anxiety disorders. And here's what I'm talking about. A parent, I've had multiple parents do this, who they reprimand their kid for struggling in the classroom. Keep in mind, I had a parent get upset with a kid who has all A's and B's. Okay? And the parent's perspective was, well, I'm a parent. I'm supposed to be hard on my kid. Like, that's what I'm supposed to do. I want my kid to do the best that he can do. And so I was trying to figure out, okay, he has straight A's and B's. Like, what is his best? And I can understand if you feel like your kid is a straight A student, you're going to want your kid to get straight A's. But what I want you to keep in mind is that if your kid has, for example, ADHD, they are having to work 3 or 4 times harder than the kid sitting next to them in the classroom to get the same grades as that kid. And so when you start putting this additional pressure on your kid, not being empathetic to how difficult it is for them, and then to still end up with A's and B's, please be gentle in your approach to this. Pick your battles. The situation with this particular kid, the kid noted that he was getting A's and B's even before the parent got ADHD medications for him, which means he was having to work even harder then, and he still got A's and B's. If you have a kid who's unmedicated and they have ADHD or one of these other diagnoses, and they still end up with A's and B's, keep that in mind. And for this particular kid, the parent got, medication in place, which has helped tremendously. But I feel like the kid deserved credit for the fact that unmedicated, this kid was determined to get A's and B's. So the additional pressure was unnecessary. And so what has happened is the kid has began to sink down into depression and experiencing some feelings of worthlessness, feeling like I can't do anything right. And of course, a kid's going to feel like that. If they've been working hard, they end up with A's and B's, and the parent is like, you could have did better. The feelings of worthlessness lead to feelings of hopelessness. Hopelessness is, this is not going to get any better. This is my whole life. Because the kid knows, okay, I have a psychiatric diagnosis, and so if I'm always going to have this diagnosis, then I'm always going to have the problem of never being good enough. And you don't want your kids to feel that way. You do not want your kids dropping down into depression. We covered the diagnosis of depression on the radio show. So for those of you who do not know all the symptoms of depression, because a lot of people think that it's sadness and that's it. And that's not the case. A person can have depression without even having the symptom of sadness. I'm not going to go into that. We covered it on the show. So if you go to our Facebook page, there is an episode of the radio show where we are diagnosing depression, where I walked our listeners through the process of being able to diagnose themselves with depression. There's a diagnostic tracking form that can be printed off from the Facebook page to track the symptoms, to count them up at the end to see if you have enough symptoms to meet the criteria for depression. So I kind of like for people to have an idea of where they are at with diagnoses, so that when you do get to therapy, you're informed. Like, you know what your symptoms are and what your potential diagnosis is. But that's a whole nother subject. All right. One of the things that I want everyone to remember is that ADHD, they used to say, that particular diagnosis, they used to say that people outgrow it. And so what I have had is parents, once kids reach like adolescence, and they're like, why is he still struggling with this? Why is this still a problem? Well, this isn't something that people outgrow. They just learn to manage it better. And adults tend to gravitate towards professions that the hyperactivity is not a problem. Professions where it benefits them that they have a lot of energy. And as far as the inattentiveness, the struggles to focus, people just get better at managing it. Your job as a parent is to assist your kid at getting to that point. Getting to the point where you think your kid has outgrown the diagnosis, but they haven't. They're just managing it better with your love and your support. Okay? So parents, please stop acting a fool with your kids. That's basically the purpose of this video. I am tired of parents bringing kids into therapy and raking the kids over the coals for symptomatology that they have no control over. Please stop doing that. Stop it. All right. I think we're good for today. Thank you for listening to this video. If you all have any questions about your particular situation, as always, you can email us, speaking the unspeakable 0608@gmail.com, or you can visit our Facebook page and send us a message. Any questions you have, whether it's about this or about anything, we will get to your questions. If we don't get to it on the radio show, we will get to your question on here. All right, once again, thanks for listening to this video. Take care.